Welcome to my third video for AD hypnotherapy. I'm going to talk about hypnotherapy as part of a treatment plan. Now, mental illness is generally not a simple matter. There are a few people that have a condition and they have one treatment and it works. But for many of the rest of us, it's a bit more complicated than that. You may be taking medication. You may also be using a talking therapy or another therapy, and you may have a diet plan or other strategies, and together that can loosely be described as a treatment plan. Of course, it is possible to have one that's much more formal than that. But in my experience, people with mental illness who are coping with it, or even not coping with it, are best served with an approach that has more than one component. Now, hypnotherapy can be used as part of a treatment. It doesn't have to be the whole treatment. It's a great first step towards getting the help you need, and it can be a useful extra step as well. A treatment plan may include other things other than the ones I've mentioned, including, for instance, support groups. There are some very good support groups around that I know of for bipolar, for schizophrenia, certainly for depression, and I'll make a note now, I'll do a separate talk and go into a bit more detail about those. Certainly counselling, personal counselling, grief counselling, there are many different varieties of it. There's also general counselling. I know a number of people who have mental illness who take medication who also use counselling. And certainly, depending on how serious the mental illness is, certainly you should be discussing matters with your GP, and if medication is involved, or possibly even when it isn't, to get a referral to and regularly discuss with your psychiatrist. Particularly if you're taking medication, if you are considering changing the medication or going off the medication, or discussing difficulties with many medications have side effects. You should certainly discuss that with your GP and particularly with your psychiatrist. As a hypnotherapist, I am not allowed to make recommendations or to tell you to do this or that. In fact, I'll do another talk with more detail about that too, because that's quite an important area. But the main point of my talk is to consider hypnotherapy as part of a treatment plan, and I will do my very best to help you get the improvements, or maybe some of the improvements, or work on improvements that will make your life